Good evening, everyone. Welcome to yet another insightful edition of MedAI Web Hour brought to you by Doctors AI and MedSynapse in collaboration with the Indian College of Artificial Intelligence in Medicine. Today is the eighth episode of the MedAI Web Hour that we've been doing, and we assemble every second Thursday of the month from 9 p.m. to 10 p.m. and we discuss the things that excite us the most as doctors, the field of medicine and its integration with AI. We all at Doctors AI are a little bit tech junkies, so we'll try to push the boundaries. We try to explore what more can be done along with medicine that has been that the way we've been practicing for over the ages. So in today's episode of Med AI Web Hour, we bring together two very brilliant minds who are shaping the future of medicine through power of artificial intelligence. We have with us two distinguished guest speakers. First one is Dr. Gurunath Parale, who will walk us through the fascinating applications of AI in ECG interpretation. So, Dr. Gurunath, sir, has MD and DM in cardiology. He has done various fellowships. Team, if you could just show the CV slide of Dr. Gurunath, sir. He has done various fellowships. He has been the fellow of American College of Cardiology, Indian College of Physicians, fellow of Cardiological Society of India. He has done his training in interventional cardiology from CMC Vellore, PGI MER Chandigarh. He has had various academic as well as administrative um, assignments that he has excelled. There are a lot of socio-medical activities as well. He's been on many media activities. He's been a guest speaker at many CMEs, and he has spoken on balloon valvotomy, angioplasty, echocardiography, ECG, etc. But the thing that excites us the most is his contribution to AI. He has presented two papers at APHRS conference in Sydney, October 2024, and his paper was accepted at ACC Asia conference of Singapore, May 2025. I welcome you, sir, and thank you so much for taking time out and being a speaker on MedAI Web Hour. We are nearing a Doctors AI Global Summit in November, and all these MedAI Web Hours have been stepping stones towards a big thing that's happening in the field of medicine and AI in November 2025. So I hand over the mic to you. Welcome, and you may start the session.
Okay, Okay, thank you, Dr. Aishwarya. So the topic which I have been given is to speak of AI in ECG. This is my one of the favorite topics, both AI as well as the ECG. In fact, ECG was one of the major determining factors for me to choose the super specialty of cardiology way back in 1989. Now, the common question I face to whenever I say of AI ECG, the common question which I am faced from many doctors is what we already have computer interpretation of ECG. So what AI is doing different? Now the basic thing which differentiates the computer interpretation and the AI interpretation is that computer interpretation depends on some formula which has been fed to the computer. Like suppose for the diagnosis of left ventricular hypertrophy, we feed a formula of SV1 plus RV6 more than 35 millimeters, then you say it is LVH, left ventricular hypertrophy. So whenever the patient has this on ECG, the computer interprets it as left ventricular hypertrophy. But as you know, there are many false positives as well as false negatives. Many thin chest wall patients, they fulfill this formula, yet they don't have left ventricular hypertrophy, as well as many thick chest wall patients who have left ventricular hypertrophy don't have this formula. So there are many false positives and false negatives. As against this, how does AI interpret? In AI, you give multiple ECGs of a particular diagnosis. Like suppose this patient like ST elevation. You give multiple the ECGs of patients who have proven left ventricular hypertrophy on echo, and the model itself learns what are the patterns which to say that this patient has left ventricular hypertrophy, and it itself comes out with some pattern with which it diagnoses left ventricular hypertrophy. So the left ventricular hypertrophy which would be diagnosed from AI model will be more accurate with less false positive and false negatives as compared to the computer interpretation. Now see again here you will see that there is HT elevation. In HT elevation can be because of multiple causes, but when a computer will interpret HT elevation and infarction, if it is fed with the formula, if there is more than 1 millimeter HT elevation in two adjacent leads, it is infarction. But we know there are many other causes of HT elevation. This the computer interpretation will not be able to do. But in AI with proven STEMI, proven infarction, we give the ECGs to the model, and it itself comes out with some pattern with which it is able to diagnose. So the diagnosis which AI will make will be more accurate than what the computer interpretation is. Then how does AI different from the human eye? Now here on this side, you will see this is a normal a 12 lead ECG with which we cardiologists or any physicians make a diagnosis. So we make our diagnosis with the help of these waves, P, Q, R, S, T, and all these segments, PRA segment, ST segment, and all. So with just 6, 7 parameters, we make our diagnosis. But as against this, how does AI make a diagnosis? Now this is a digital representation of a ECG. In digital representation, you have, because of the space constraint, I have shown only 35 rows here. But each lead in even a low, what you say, the basic ECG machine has 5,000 rows. So the number of rows are minimum 5,000 to 15,000, depending on different machines. So with each lead 5,000, so you can leave 60,000 points. So AI looks at 60,000 points minimum, and the good machines they have more than 1,20,000 points. So we humans look at 6, 7 waves, but the AI looks at more than 60,000 points. So whatever the diagnosis which AI comes up with is likely to be more accurate, and what human eye cannot see, the AI can see. So that's the difference. And why I'm not able to go forward. Okay. So now there have been certain applications with many papers which have come for the how the AI has been used in ECG. Most of this, all this data is from the Western world. Basically, the data which I'm going to quote is the largest data has come from the Mayo Clinic. Now, AI ECG for the detecting left ventricular dysfunction. Now they trained the model using more than 50,000 ECG echocardiogram pairs, and they trained the model to diagnose left ventricular dysfunction on ECG. Normally, we know we diagnose left ventricular dysfunction from echocardiogram, the ejection fraction. We diagnose it from echocardiogram. And the ECG, we have very little clue from ECG itself whether the left ventricle has dysfunction or not. And routine 12 lead ECG for any physicians to diagnose left ventricular dysfunction is next to impossible. So they come out with this model which shows a very high accuracy, a high sensitivity and specificity for diagnosing left ventricular dysfunction with the ROC curve going right up to the right corner. And just to give you some examples, now this is the ECG. This ECG was given to the AI model and asked whether there was left ventricular dysfunction. The AI model said that this patient had left ventricular dysfunction, but in reality, this patient's ejection fraction was normal. So it was labeled that this was a false positive. So AI misdiagnosed it. It was labeled. But surprisingly, few years later, this patient developed left ventricular dysfunction. So a, a concept came whether not only AI can diagnose low ejection fraction or left ventricular dysfunction, whether it can predict what is going to happen in future, like an astronomer. And so multiple studies were conducted, and it was shown that around 30% of the patients in whom AI model predicts left ventricular dysfunction. Although the left ventricular function is normal at that time, 30% of them develop left ventricular dysfunction over next few years. So this concept has been known as a previvor concept. So ECG not only diagnoses left ventricular dysfunction, it can predict left ventricular dysfunction, which is going to happen in future. So this, it has been shown around 30% whom it was labeled as normal. The ejection fraction was normal, but AI labeled as abnormal. They developed low ejection fraction over the time. Now, this ECG, if we given to any cardiologist and asked about whether the patient has left ventricular dysfunction, it is very difficult for us to tell whether LV dysfunction is there or not. But when AI model was given this ECG, it said that this patient has a 76% probability of having left ventricular dysfunction, that ejection fraction less than 35%. In fact, patient ejection fraction was 18%. So AI is able to do what human eye cannot. In fact, a a stethoscope is in research where a stethoscope can record a single lead ECG, and this is a Lancet article, and this with single lead ECG, if you are able to diagnose left ventricular dysfunction in casualty itself, in the emergency itself, you will be able to tell whether the patient's dyspnea is because of the cardiac cause or the respiratory cause, and that can help patient triage. Now, another important application of AI is to detect silent AF. You know that many strokes happen suddenly, and atrial fibrillation is one of the important cause of embolic strokes. But this atrial fibrillation is many times intermittent. That whenever a patient goes to the doctor, his ECG is normal, it shows normal sinus rhythm, and only for few seconds there is atrial fibrillation, and in those few seconds he develops embolic stroke. So just imagine during sinus rhythm, if we are able to diagnose that atrial fibrillation when patient ECG is normal, what difference it can make. Just to give you an example, this was a 65-year-old lady. She had atrial fibrillation. She had stroke. She had stroke in 2014. She was extensively investigated. There was no atrial fibrillation or anything. So she was not anticoagulated. 6 years later, she had another stroke. Again, she was investigated. There was no atrial fibrillation. But few months later, she developed atrial fibrillation. So probably she was having intermittent atrial fibrillation. So just imagine if you could diagnose atrial fibrillation in her first stroke, then perhaps you could have anticoagulated and prevented the second stroke. So that is the power of AI in ECG. Now another case. This is the patient. This ECG. This is the patient. In 2008, AI model was given this ECG. It said there is no intermittent AF. That silent AF means intermittent AF, and just few PVCs are there. Then few years later, 5 years later, this ECG was given to AI model. If you see, except for VPCs, these two ECGs are nearly identical. For a human eye, there is hardly any difference. But AI model said the silent AF is there. I don't think any human can diagnose this. And this patient later on went on to develop atrial fibrillation. So this is again the same Mayo group which has developed this algorithm to diagnose silent AF using more than 36,000 patients. And this is a ROC curve with a good accuracy of diagnosing silent AF. Another important application of AI in ECG is for detecting hypertrophic cardiomyopathy. Uh, when ECG shows the classical changes of hypertrophic cardiomyopathy like deep TV inversions, it is easy to suspect. But in 10% of the patients of hypertrophic cardiomyopathy, the ECG is normal. And here, the ECG, AI ECG can make a difference. So again, the same group has developed a model, and they have found with a very high accuracy on ECG itself, the diagnosis of hypertrophic cardiomyopathy can be made. To give you an example, now this patient, if this ECG is shown to any cardiologist, I doubt whether he will diagnose hypertrophic cardiomyopathy on this ECG. But when AI was given, it said that this patient has a high probability of having hypertrophic cardiomyopathy, and this patient had a hypertrophic cardiomyopathy. In fact, this patient underwent surgery for hypertrophic cardiomyopathy, and this was the ECG after surgery, after myectomy of hypertrophic cardiomyopathy. And then this ECG was given to the AI model, and it said now the chances of HCM are very low. For us, humanized, we cannot diagnose this hypertrophic cardiomyopathy on either of these ECGs. Now, another example. This is a young lady who came with syncope. And if we are given this ECG and asked the cause of syncope, I doubt whether we will be able to diagnose the cause of syncope on this. And this lady will be subject to a battery of investigations, cardiac as well as neurological, electrophysiological studies, and everything. But when this ECG was given to the AI model, it was said that there is 72% of possibility that this patient has hypertrophic cardiomyopathy, which is a cause of syncope. See, with no hi-fi investigations, a simple, cheap, easily accessible ECG, the AI model is able to diagnose hypertrophic cardiomyopathy, and so many sophisticated, expensive investigations could be avoided only just within this AI model. Not only the AI can diagnose the hypertrophic cardiomyopathy, it can tell on ECG alone. This hypertrophy looks same on echo of all causes. Means hypertrophic cardiomyopathy, hypertensive hypertrophy, athlete's hearts, hypertrophy because of aortic stenosis, the infiltrative diseases like cardiac myocarditis, all have hypertrophic pattern on echo. And echo itself is very difficult to tell what is the cause of hypertrophy or thickening of the left ventricle wall. But the AI model have been developed where ECG alone can differentiate the hypertrophy, the etiology of hypertrophy, whether this hypertrophy is actually hypertrophy or whether it is infiltration like amyloidosis, or it is pathological hypertrophy like hypertrophic cardiomyopathy, or it is physiological like athlete's heart, or because of aortic stenosis or hypertension. Only on ECG you are able to tell this. Now, another interesting application of AI. Normally, we say our age as a chronological age, that is from our birth date. But it has been postulated that ECG, if you are so the age, it is postulated that with ECG you are able to predicts patient age, but the age which is predicted from ECG is more likely to be a biological age. Normally, when we talk of age, it is called as it is actually a chronological age from our birth date. So it is postulated that if you are able to determine the age from the ECG, it is likely to be a biological age. And with a very high accuracy, you are able to predict patient age. And in fact, it has been found that the age, if the ECG determined age and patient's actual age, if the difference is more than 7 years, then this patient is, if the ECG age is more than 7 years from the patient's chronological age, then these patients are likely to have a higher mortality. Uh, and in fact, this has been shown in this study. If the gap is more than 7 years, then you're likely to have a higher mortality. Now, this is very interesting example here. Now, this is a lady who has 106 kg weight with 39 BMI. Her actual age was 34 years, but the ECG determined age was 40 years. So probably the biological age was more than her actual age. Over next 2 years, she lost 10 kg. After losing 10 kg, her weight became 96. And here, now her actual age was, after 2 years, was 36 years. And AI ECG also is 36 years. So on ECG, see how useful this ECG can be a motivating factor for the patients to adopt different lifestyle changes. Actually, for humanized, these two ECGs look the same, but AI looked at them differently. And this is how it can make a difference. And maybe this predicting a biological age can have tremendous implications, maybe for in insurance sector and so many for the lifestyle modification or the preventive measures which we can undertake. This is an interesting slide taken from Dr. Friedman of Mayo Clinic. In his one of these talks, he showed this slide where it has been shown that on this axis is the chronological age and y-axis is the biological age. This patient's biological age was more. When age was 38, biological age was around 55. With time, the chronological age increased, biological age also increased till this point at the 53 chronological age. And suddenly then the biological age started decreasing. What happened? So we asked the audience, what happened? Why Suddenly the biological age has started decreasing. And he got funny answers. Someone said that he got married. Someone said he got divorced. But what happened actually? Well, this patient underwent heart transplant. This patient had a dilated cardiomyopathy and underwent heart transplant and got a heart from a younger patient. That's why his biological age came down. So this is how ECG can be very useful to diagnose chronological age. So in future, perhaps you can have, now this is your standard ECG interpretation which we see today, and maybe in future we'll have this dashboard displayed on the ECG. What is his estimated biological age, whether he's a male or female, what is whether he has a low EF or not, whether he has silent AF or not, whether he has hypertrophic cardiomyopathy, so on and so forth. In fact, not only hypertrophic, the ECG can diagnose pulmonary hypertension with high accuracy. It can diagnose aortic stenosis with high accuracy. So multiple papers have come with it can diagnose multiple conditions purely in ECG, like congenital heart diseases, supraventricular tachycardia, and so many things. In fact, it is some you can reconstruct a ECG from 3 leads to 12 leads with using AI models. Not only it can diagnose cardiac conditions, ECG has been shown to diagnose some non-cardiac conditions, also like new onset diabetes, thyroid disorders, anemia, cirrhosis, so on and so forth. In short, your ECG can be your kundali. It can the help kundali where it can diagnose multiple things. The ECG alone can diagnose multiple systemic diseases. Of course, there are challenges and limitations. I won't go into all these three. Only just to give you one example of challenges is this ECG. This ECG, in fact, if you see ECG to a naked eye, this is a single ECG. But when you magnify a part of it, you will see there are two overlapping ECGs, one in the blue color, one in the red color. So ECG in the blue color, when it was given to the AI model, it said that this ECG belongs to a male. But when ECG in red was given to the AI model, it said this belongs to a female. So little noise on the ECG totally changes the diagnosis. So this is the importance of the quality of the data. So not only quantity, the quality of the data, the qualities of ECG also is very important to make correct AI models. As I told you, most of this data is coming from Mayo Clinic and there is no Indian data. So because if to for AI application, we know we need a large data in EMR and a long follow-up and ECG is in a digital format. So I decided to take a baby step in ECG because I have a large data of over 60,000 patients over 12 years with 1 point more than now it is more than 2 lakh ECGs in digital format with their clinical diagnosis. So first I thought, why not develop a model in left bundle because this has not been done before. You know, to diagnose heart disease in left bundle branch block is difficult on ECG alone. So I thought whether AI can diagnose, a human eye cannot diagnose, whether AI can diagnose. So I had a few patients of around 317 patients of LBB, extensively worked up with angiogram, echocardiogram, everything. 117 had coronary artery disease, 97 had left ventricular dysfunction, but no coronary artery disease, and 103 they were normal. So I developed a model with the help of IITs and then found with a high accuracy of around 81% on ECG alone, we could diagnose structural heart disease in presence of left bundle branch block. In fact, this was the paper which I presented in Sydney APHRS last year. Then I thought, why not construct 12 leads from 6 lead chest leads? Because if there are many variable ECG patches, so if you have a 6 lead chest lead patch and patient can record ECG at home, just put a patch on his chest, and if whether he can develop the 12 lead ECG, then this also with not a very good accuracy. The accuracy was good for lead 2. You will see the original and predicted ECG are overlapping. Lead 2 could be accurately, the limb lead could accurately be predicted from the chest lead 2. Lead 1 also fair degree of accuracy, but some leads the accuracy was not there. I am still developing further refining this model and aim to develop a 12 lead ECG from 6 lead. Then the AF, what we saw earlier, I had many patients of AF. So I thought whether I can develop a model to see whether we can okay. So now uh, whether I can develop a model now. So I have developed a model with this. Now here I will show you with this model live. You can see my screen. Yeah, just I'll show you this. If I can use any ECG here, which is in digital format, and I say start analysis, and it will say this normal sinus rhythm, atrial fibrillation probability is 26.6. Like that, it can be developed. So this is how a silent uh, prediction from the silent AF we can make. This is the model, online model which I am having. So this is a paper which I presented again in Sydney or silent AF, and it's a sub part I presented in ACC Singapore. Similarly, I have developed a model for age prediction. This don't think I have shortage of time, but I'll show you. I can predict age from the ECG alone, and from this ECG, I could predict age. In fact, I have also developed a model for predicting left ventricular systolic function. As you know, the model which I showed is for the ejection fraction, but now a new concept has come. It is called as a GLS, that is global left ventricular strain. This is considered to be more accurate than ejection fraction, and it is not subjective as ejection fraction and not time or load dependent. In fact, I have developed a model where we can predict left ventricular dysfunction using GLS. And this I could have shown you because shortage of time. I won't. This is a live model which I have. If you permit, I can show you the ejection fraction. Fine. Okay. These are the ECGs, and I have developed this model with the help of IIT Jodhpur, IIT Roorkee, and CDAC. And I would like to thank them. And I'm still developing few more models with these people. Thank you.
Thank you. Thank you so much, Dr. Gurunath, sir. Uh, it is definitely something that uh, we need to have on like an hour of your lecture so that we can deep dive this further in. We'll definitely do that in the coming sessions. But due to the model, the way this web hour works, we have to sort of wrap the things in an hour. So we will definitely continue the talk, the discussion further in our chats. Meanwhile, there have been some questions from audience.
So, Aishwarya, before you
Yes.
go for the questions to Dr. Gurunath, I just want to
Yes.
take 1 minute of the from the house. And
Sure,
first of
sir.
all, I want to congratulate Dr. Gurunath sir for taking this initiative as a clinician. I think it's a fantastic work that you're doing on developing these open source models, and we have been following your activities that you have been doing and your active participation in our journal club. And also, I think today's presentation was great. Of course, it's too short a time for you to present the entire work. So what we're going to do is going forward, we're going to break this into beats and pieces, and we're going to kind of keep separate sessions for you where you can actually take the whole realm of ECG interpretation using artificial intelligence, in a series-wise manner. So we will plan that from the Indian College of AI in Medicine. We of course look forward to have you in our conference as well, and I'm sure many of our members of ICIM and Dr. Zia will be very eager to interact with you in person. And many developers who are developing AI tools, for ECG interpretations and predictions of cardiac diseases from ECG patterns will be very excited to collaborate and work with you and maybe take your models which you have developed to the next stage or into the industry level. So great, that's the spirit of AI entrepreneurship. And once again, from the end of Dr. Zia, we thank you for taking this initiative. I'm sure this will be inspiring so many cardiologists, young or old, to explore using artificial intelligence. Now over to you, Aishwarya.
Thank you so much for your wonderful 30-minute session by Dr. Gurunath sir. And there are a few audience questions coming in. One of them is, are there any specific patient populations or clinical scenarios where AI applications in ECG interpretation or other tools should be used cautiously?
As of today, it has to be used cautiously because in fact, even in the maybe very few models have been approved by US FDA. Maybe Apple Watch for AF detection and some Medtronic algorithm for electrophysiology, and some Holter, they have been only approved. Others are still investigational. So as of today, we can use this AI model for our more learning purposes because still a while to go before we implement them in our practice. I am also now, in fact, these models, day-to-day basis, I am studying them. These models on daily, every OPD patient who walks into my OPD, as subject his ECG to the AI model, get the prediction, and I am sort of conducting a registry, which I have enrolled with CTRI, and I'm doing a registry and see how these models perform in future and their actual real events, whether they match the future events.
Thank you. Thank you so much, sir. We have time for like 30 seconds for another question. How do you foresee AI evolving in cardiology over the next decade? The answer to this question can't be in 30 seconds, but like your comments.
I think this I just gave you a glimpse. This is just ECG. In so many fields, the AI is going to make changes. In echocardiography, already it has made changes. All the current ECG, echocardiography machines, they have integrated AI, which makes the diagnosis so easy, fast, like calculating ejection fractions, regional malformation abnormality, global GLS. That's very fast. In cath lab, in electrophysiology, it has been integrated with the present systems. Intravascular ultrasound, it has been integrated. So many, it is getting integrated everywhere, and it's just a question of time where it will become indispensable tool in cardiology.
Definitely, sir. Thank you. Thank you so much.
So I think one important thing is, I think Rakesh is just left, and I just wait for him to come back. Maybe he's having some technical thing. But one important thing, Dr. Gurunath, what we can do is, we can definitely have one total on our web interface, on our platforms, anywhere on the open source, which can be a ready to use prediction model for clinicians, which is not going to be an industry based models, because see, we all of us, whether we are an intern, whether we are a postgraduate, whether we are a junior clinician, early career physician, or a senior clinician, we are all looking at ECGs, whether we are a surgeon, a physician, or a ENT specialist, everybody. So if there is some kind of an open source model that we can all develop together for the medical fraternity, where people can just go in and post their ECG and get some kind of prediction, and it remains validated with sort of federated learning in the back end with your guidance and support from ICI, and that will be great. That will open up a whole new avenue of ECG predictions coming in. And like we say, retina is the window to so many cardiovascular diseases. Just the way, the ECG waves can be a window to diseases even beyond cardiology. So let's think on those lines, sir, and just
yeah. The problem here is the models which I have developed, or the models which have been developed, they are under digital ECGs.
Yes.
And unfortunately, none of the clinicians or the hospitals, they record a digital ECG.
Right. That's
I
true.
record that ECG of the numbers. So I'm at present thinking of developing some models on the JPEG or the PDF. I'm thinking of developing some models on JPEG. Of course, those models will not be as accurate as the digital ECG model, because as you know, the image and the digital will be definitely, there is a gap between that. But maybe we can have some idea. So in fact, my next model which I am developing is diagnosing obstructive coronary artery disease on the ECG alone. That is the next model, and that model I'm developing on the 12 lead ECG image or JPEG image. That's the ECG which you see, not the digital image. So that is the model which I'm developing. I hope maybe in next couple of weeks I'll come out with that model.
Fantastic. So we look forward to your developing works, and I'm sure we will collaborate with you on a larger scale. Aishwarya, let's take it away for the next speaker. I think it's more practical now into hands-on learning of AI, which Dr. Rakesh will show us. And if you have his opening slide, if you can just read out, he's already presented its screen, so just read out his CV, please.
Have with us the next speaker, Dr. Rakesh Parikh. He is a fellow of American College of Endocrinology, Royal College of Physicians and Surgeons, Glasgow, and College of Physicians and Surgeons of Bombay. He's a member of National Executive RSSDI. He's a founder of Metabolic Society Jaipur, co-founder DTech. He's a recipient of several awards on editorial and reviewer boards of various journals, over 70 publications, including textbook chapters. He is a regular speaker at various diabetes conferences, and he's a principal investigator on several global phase 3 trials. It's an honor for us to have you on MedAI Web Hour, sir. Over to you.
Thank you, Dr. Aishwarya, for the nice introduction. And first of all, let me thank Dr. Amit Day for giving me this opportunity. Am I audible clearly? Okay. So thank you, Amit, for inviting me here. And it's really exciting to attend this session. I heard Dr. Gurunath's session, and we are, I mean, for myself, we are just learners in AI. So I am just learning a lot from people like Dr. Amit Dey, from his lectures. What I am going to present today is basically the very basics. If there are any beginners in the audience who have not tried using AI tools for their practice, probably it would be very relevant for them. So, first of all, let me compliment Dr. Amit for this initiative. I was really surprised to see the whole lecture of Dr. Gurunath. I mean, there is a whole community of people who are working in AI among the doctors. It needed an effort from somebody to unite them all and bring them all on a platform. And probably Amit has done a very good job by creating that platform as Doctors AI. So compliments to you, Amit. And thank you, MedSynapse, for arranging this webinar. So I am going to talk very basics about leveraging the free AI tools which are freely available for doctors in their own clinical practice. I'll start with this first slide, which I like very much. This slide has been there since decades, I would say, and it gives a very good message that you are so busy in your own life that if somebody comes up with a solution that can probably ease your job or make it very easy, still you're not able to or not willing to listen to him. So I would say that in today's time, probably AI is such tool, and many of us are having inertia in using it because we are too busy in our jobs. But believe me, these AI tools would actually ease your work and make your jobs very easy if you start using them. So, okay. So before we go into details, I am sure many of you would be aware of these basic terminologies, but I think it's customary for people who might be listening to a talk on AI for the first time. It would be better for me to explain them the terminologies, what I understood about. So AI is a broad term where a machine is showing some kind of intelligence, and this has been there in many machines since decades. We have been using computers and so many tools. They all have some kind of artificial intelligence. But when you talk about machine learning, it basically means the machine learns from the data that it gets. So, for example, that applies to all of us. The tools like Google, Facebook, they learn from our behavior and then they change their own behavior with us. That is what is machine learning. The machine is learning from us, from our inputs, and changing its behavior based on the lessons that it learns. Then the another advanced version of machine learning is deep learning, where it mimics the human brain. So there are complex neural networks involved here, and they can perform complex tasks like the facial recognition or the natural language model, where the machine understands your language in the human language. So these all things come under the deep learning, and again, it has been there for many years. So the facial recognition softwares, the Google Lens, and so on, they are all using deep learning algorithms. Even the fundus cameras that we use, which are AI-enabled fundus cameras, they also are based on the deep learning algorithms. What has come up recently in last few years is generative AI, because of which there is a lot of discussion on AI and a lot of conferences and CMEs happening on AI. These are because of generative AI. Because in addition to all these capabilities that they had earlier, now the AI algorithms can generate content for you. The content can be in the form of textual content, it can be audio, it can be video, images, and so on. And that is what is exciting, and that is why the whole scenario is changed now. So today we will restrict our presentation to only the use of generative AI, and particularly the tools which are freely available for all of us in our day-to-day practice. But AI as a whole has got a lot many applications in the field of diabetes specifically, because I practice only diabetes. These are the four broad criteria, four broad areas where a lot of work has been done using AI in diabetes care, although there are several other aspects also. The one is automatic retinal scanning that many of us have been using, where the fundus cameras, they have some AI algorithms because of which the fundus cameras can detect whether the fundus is normal or it requires a referral to the ophthalmologist and that is all based on the AI algorithms. The second aspect is clinical decision support. So there are some systems which are now even FDA approved, where the AI algorithms can help you in making your own clinical decisions. The third area is prediction and risk stratification. So there are several models now that are being developed, some based on even ECG. I was wondering when Dr. Gurunath was speaking, he has got a data of 60,000 ECGs, and if he has the data labeled as diabetic and non-diabetic, probably he can run it through machine learning algorithm, and maybe we can get a model that can even detect people or the risk of getting diabetes based on the ECG also. And there are papers on that also. Then there are several digital self-management tools which are useful for patients with diabetes, for self-management as well as for education of patients. So we'll not talk about all these today. I'll restrict my presentation only to the applications of generative AI in the practice, specifically the diabetes practice. So as we all know that Gen AI has got several applications, and one of those is the healthcare and diagnosis and prognosis, and we'll talk about that only. Now, there are several tools in the field available now, and the most common ones that are used by us are ChatGPT, Gemini, Meta, the Grok, and then there are several other applications which are used by the people who are advanced users of the generative AI. But I will today talk about only ChatGPT because I use that only a lot. Now, if you install the ChatGPT app, this is how you see the screen. The ChatGPT app is freely available, and you can install it, log in with your Google credentials, and it acts like a versatile AI assistant for you. So it will provide help you in several tasks that you need to do repeatedly. It can generate ideas for you. It can help you in writing, and it is very easy even for the beginners to start with. So once you open up the ChatGPT app after login, before that I'll show you the QR code. So if there are any people who are not yet installed ChatGPT, they can scan the QR code for the Play Store as well as the App Store and install the app, and then you can start using it through the presentation as we go ahead. So once you install the app, this is the first screen that you see, and on this screen you will see mentioned as ChatGPT 5, which is the latest version of ChatGPT that we have now. So Amit actually asked me to talk on ChatGPT 5, but I have not myself got time to learn ChatGPT 5 yet. So I'm not talking about ChatGPT 5, but this is the latest version of ChatGPT that is available. And here you had the options to change the versions earlier. Now I think that they only have ChatGPT 5. The older versions probably are not visible now. Then second place where you see ask anything is written, that is the area for prompting. So prompting basically means the language in which you interact with the ChatGPT or any generative AI model. So that is the area where you type something or say something, and that the ChatGPT will understand and then respond to. So that is the area for prompting. Then the third area here, the plus icon, it is for attaching a file. So if you want the ChatGPT app to read a file for you, analyze a file for you, read an image for you, you can attach that file by using that plus icon here. This microphone icon, it is for in case you are too lazy to type and you just want to give a virtual command, give an audio command, you can click on that button, say the prompt, and then it will be typed there. And the last icon that you see is for audio communication. So the ChatGPT 5 and even the older version also, you can audio communicate with ChatGPT. So you talk to the ChatGPT and it responds to you in audio itself. So these are all the basic icons that you can use when you are using ChatGPT. Now, if you click on that button where you see the two small lines there, then the menu option opens, and then again there are some fields here. So the top one, that is for search. So here you can search any chat that you did with ChatGPT in the past few days. So suppose I was chatting with ChatGPT on a particular topic a week back, and now I want to go back and start from there itself. I can search for that chat. The chat will open, and then I can continue my conversation where I left it. The second option here you see is for explore GPTs. So there are something called custom GPTs, which are customized for a particular task or objective. We'll talk about that in the next few slides, and you can search for those custom GPTs by going on explore GPTs. Then you can also have a project. So if you have some project you are working on, you can create a project, and then the more you interact with in that particular project, the ChatGPT will remember the past history and it will understand the context of what you are working on. And then you have a library also. So if you have created some images using the ChatGPT, those all will be stored in the library section of your app. So now, this was all the basic user interface of the ChatGPT app. The one thing which is the most important is prompting. Prompting means the way you interact with the ChatGPT, and it itself is a huge subject. There is a branch called prompt engineering, and people like Amit do take talks on prompt engineering. They will tell you how you can fine tune your skills of prompting with ChatGPT, and there are several ways of prompting. But basically, for a beginner, you need to be very clear in your instructions. So the more specific you are, the better answers you will get. So whenever you are uh, prompting or giving some command to the ChatGPT, you begin with a direct command which is very specific. Guide it what you are looking for, what is your objective, what is your goal, and the more clear you are, the more specific you are, the better results you will get. Then you might provide some context with some examples. In case you want to elaborate on, you can give an example to ChatGPT and it will understand, and then it will respond to you accordingly. And you can refine your prompts. So if you are given a prompt and the response that you are getting is not what you are expecting, you can refine your prompts and then continue the interaction. That is how a beginner can start prompting with the ChatGPT. What are the applications for a diabetologist or a physician in his clinical practice? You can use it for clinical documentation, for literature search and summarization, for review of literature, for any administrative or productive work. You can use it for patient education, creating visuals for patients, for data handling and analyzing the data, even for making the PowerPoint presentations, even for manuscript writing. These are the basic uses that anybody can use a generative AI tool for in his own practice without spending much, because these are all mostly free and freely available. Although there are limitations when you start using it free of cost. Now, for patient education, what all can be the uses? You can use it for creating educational content. Suppose you have a blog where you write on some particular topics of diabetes, say on diabetic diet or on exercise or on a particular medication or on obesity or on the complications of diabetes, something that you want to be written in the language that a patient or a layman can understand. You can ask ChatGPT, you can give a proper prompt, and it will give you a lengthy blog that you can use after verifying, of course, and then you can use it for publishing in your own blog. You can also take printouts for giving to your patients. If you want to create some infographics or some images to explain your patients, whether it is of a balanced diet, whether it is an image of pancreas and its role in controlling blood sugars, you can ask the ChatGPT what you are visualizing, and it will give you a output which can be the image that you're looking for. You can use them for making some diagrams, for making infographics, and it can also be useful for communication with the patients. You can even integrate these models with WhatsApp. Dr. Amit Dey has earlier created a chat bot. I think the name was Madhu, where you can interact on WhatsApp and you will get very specific answers to your queries on diabetes. So such utilities can also be there. In your own clinic, you can use it as a chatbot for responding to the normal common queries of the patient, like your timings, your availability, maybe even some basic queries like about diet or exercise. And you might restrict it not to talk about the medical queries or to answer medical questions which the ChatGPT should not be answering. Now, for clinical documentation, there are several tools. You can use ChatGPT free version, Cloudy, and Google Gemini. These are all free tools. You can start using these for documentation. You can use them to draft the discharge summaries, the notes, the referral letters. All these things can be done. Generate patient-friendly explanations of diagnosis and treatment. If the patients want to understand their condition, you can give them in a written document, which can be generated by using even ChatGPT. And you can use a prompt. This is the idea just for example. So suppose you want to explain a person who is a 45 years old diabetic and a farmer what is diabetes in a simple language that he can understand. So you can just give a prompt like this: explain type 2 diabetes to a 45 years old farmer in simple Hindi. So you will get output which is in Hindi and which is customized or which is individualized for a person who is a 45 years old farmer by occupation to be able to understand. So that is how you can use it for clinical documentation. For literature search and summarization, there are several tools which are available: lcit.org, Perplexity. Even on ChatGPT, you have a custom GPT, that is made a custom GPT, Scholar AI, and there are several other tools also. So most of these tools are free to use for a limited time, and if you want to use it extensively, then you can go for a paid version also. So you can ask these tools if you are looking for literature in a particular area. You can just give a proper prompt and it will give you the exact published literature which is available in that particular domain. It can also give you further details about these published literature in a summary form, and you can choose the ones that you want to. So, for example, if you want to give a prompt for looking at ADA guidelines on A1C targets in 5 bullet points, just give a prompt and it will give you those 5 bullet points. Suppose you want to look for the recently published literature on MASLD or recently published guidelines on MASLD management, you can give the prompt like that, it will give you the exact results. You can use these different tools for that purpose. Then for administrative and productivity, then there are several other tools like Notion AI, Google Docs AI, Microsoft Copilot. These are also available. And then you can use these for drafting the appointment reminders, for consent forms, for follow-up instructions. You can also translate the clinical document into local languages. So if you have a patient who is not very comfortable using Hindi or English, you can translate documents into the local language also. So just a idea or example of prompt for this: draft a 2-sentence SMS reminder for patients follow-up visit in Marathi. You don't understand Marathi, but you are practicing in Maharashtra. Ask ChatGPT to do that, and it will give you the prompt that can be used for sending the messages. For patient education and visual aids, again, there are you can use even ChatGPT also for this purpose, but there are specialized AI tools like Canva AI. They have a free version also. Binge Images Creator, Dell E. I think some of these are not available now. Create multilingual infographics for diet, exercise, medication adherence. All these things can be created. You can generate the disease awareness posters using culturally relevant images. Another example of prompt here is create an infographic explaining insulin injection technique for elderly patients. So it will create an infographic that can be handed over to the patients. Then for data handling and analysis, again, there are tools like Google Sheet now has AI built. Excel also has got Copilot, which is there. You can use it for tracking patient outcomes like A1C trends, visualize them in the form of graphs, generate quick charts and dashboards from a raw clinic data. I think I'll have to move a little fast. Then this is a prompt idea: analyze this CSV file for patient blood pressure readings and highlight the high-risk cases. So now I'll just come to the last part, which is a very important part. Custom GPTs, as I showed in the earlier slides. In the chat GPT itself, you see option for explore GPTs. So here there are several customized GPTs which can do customized tasks. So in this area, you can search for the particular thing that you're looking for. Suppose you want the custom GPT which is only for nutrition or for diet or for exercise. You can search for that and you will get so many custom GPTs which are already prepared by people, and you can create your own custom GPT also. So for creating custom GPT on your own, you will require a premium account of ChatGPT. Then you will have to log in from the web browser on a laptop, not from mobile app. So I'm just showing you some screenshot. How do you do that? So on the web browser, you open the ChatGPT, log in there, and then click on this Export GPTs option. Then you see this search bar. Here you can search for the existing GPTs. If you want to create one, you can click on the create button, and it will start the process of creating a new custom GPT for you. Here on the left side, you just need to talk in your own language, write in your own language. You don't need to code anything. In the general language, you can write the instructions about how the custom GPT should behave, and then you can see the preview of that custom GPT on the right side. And then you can publish those custom GPTs in the public domain also. You can keep it for yourself also. So I don't have much time. So in last 2 minutes, I'll just show you one of the custom GPTs which I have created earlier. This is Diabetes Clinic Assistant. And here I have given the custom GPT instructions to give these options when somebody interacts with it. So it will give you all these 7 options, which are very commonly used by us. I'll show you just 1 or 2 examples of this for shortage of time. So these are the options that it gives you. You just need to choose the number. So suppose I want to use it for interpretation of lab reports, I'll use only 4. If I want it for diet chart, I'll just type 6 and respond to ChatGPT. So here I have used it for the medical calculation. So I entered 2. It gave me these are the calculators which are available. I wanted target height. So I entered 3. It asked me for 2 things, father side and mother side, in centimeters or inches. So my input was only the numbers 176, 168. It understands these are not inches, these are centimeters. It calculates it and gives me the target height for boy and the girl separately. Same thing for FIB-4 score. Similarly, for clinical diagnosis, if you want to use it, it will ask you a few questions, give the answers to that, and it will give you the DDs of that patient, the prognosis of the patient, the probable workup that you need to do, and all these things it can provide you with. If you want to use it for interpretation of reports, just upload the PDF file. It will give you a summary of all the abnormal reports or findings from that PDF file. You can also use it, though it has got some limitations. You can use it for even the interpretation of images. So I tried this image. It gave me that this is a diabetic neuropathy. it might be wrong at times when you try to use it for this. For diet chart, I just gave a command that I want a diet chart for a diabetic person who is a South Indian vegetarian diet, BMI 31, and it will give me a diet chart in Hindi for that particular person. I can just take the printout of that also. Last two slides. So in one of workshops where I was presenting this, one of our friends, Dr. Suprati, came up with this paper sheet and he said, can you use ChatGPT for this particular purpose? So we just tried it. We uploaded that. It converted that into a table, not very useful. So we told that you make some graph out of it. It gave us a visualization of graphs of the blood sugars of the patient. Then I said, can you convert it into a AGP kind of graph? And it converted the AGP kind of graph also. The values were limited, so you don't get a exact graph that you get in AGP. So this was the custom GPT that I started using. Similarly, anybody who wants to learn can start using the custom GPTs like this. And I'm sure Doctors AI does so many webinars on use of AI tools for doctors, and they also have a course. They have a university where they conduct the courses for doctors. So I would request you all or recommend highly if you're not using AI yet, start using it and start learning it. Thank you very much. These are the key takeaways. AI can save your time, reduce your workload, and improve your communication with the patients. Many effective AI tools are free and beginner friendly. So ethical and responsible use is essential for safe adoption. Start using a free AI tool, just a ChatGPT or a Gemini, and then move ahead in the journey. Thank you very much.
Thank you so much, Dr. Rakesh, sir. It was a really good overview, a bird's eye view to all the apps, especially ChatGPT, and how we can use in our clinical practice. Time to time, we need some sort of a revision to understand like what new things have come up, and always we get to learn one or the other new things that we might have missed usually using ChatGPT. Thank you so much for doing that. There are a few audience questions. We'll take a couple. How do you balance reliance on AI with clinical judgment to avoid over dependence or errors?
Yeah, so you should never depend on AI. I would say that you use it for getting some output of that, and then you apply your own brain. For at least for medical decisions, you can never rely on AI, and you should not do that. You should not take that risk. So if it is a clinical decision that you are taking, you want it as a helping hand, maybe as a second opinion, you take it, but you should have your own clinical instinct before going ahead. You can use it for non-clinical tasks, like for a diabetic diet or a diet chart. And there, you by just overlooking that, like it created a diet chart. By having overlook, I can say that it is okay for a diabetic patient. I can give it to the patient. So I would say that for clinical decisions, you cannot rely on it. You can use it as an assistant, but then you have to have a supervision which is always there. At least as of now, you can't do that.
So, Dr. Rakesh, a very good presentation. And I think this was a very practical one, a lighter one, but it's going to help a lot of the community members, especially those people who are getting started. Because this is a question that I always say that, we talk so much of AI, but where do I get started with artificial intelligence? And right in my clinical practice, when I'm seeing 30, 40 patients in a day. So one small, quick question to you is, you've been using AI as well for quite a while. Can you recollect of one scenario where you have actually used an AI tool in your practice in front of your patient and it really made a difference? And it actually got the patient excited and happy that, okay, my doctor is using artificial intelligence to give me a better output. Or was the response the other way around with a phobia that is my doctor using AI? And is it like I've come to a doctor who needs to Google search and ChatGPT search to know an answer? So could you give one example and relate to this use of AI in your practice?
So yeah, unfortunately, Amit, I still didn't get the courage to do that because I am still having that phobia that if I tell the patient that I have used AI tool for giving some advice to you, I probably might lose the patient. So I still have that inertia. I might use it only for my own understanding, for my own learnings, but for a patient-to-patient interaction, I did not yet gather the courage to use it. Idea might be very good. I don't know what the response would be. You might have some experiences. I don't know.
So I've been doing this for a while, and my response to this is patients are usually very excited and happy when you actually tell them that, look, let's put it in AI and see what it says. This is my opinion. Let's put it in AI and see what it says. So, toggling with the images a lot on these tools. But the one kind of caveat is, we make sure that, they are de-identified before we are putting it in. So I don't put in the reports. For the plates, it's okay. The other new thing which is now available in the market is the Comet browser of Perplexity. And this is something which I had written out in the groups in the Doctors AI community, is that if you have access to the Comet browser, you can just have your entire EMR searched. And if you open up a page, it's going to summarize the patient history and tell you when was the last vaccination taken, when was the last retinopathy screen done, when was the last ECG done for the patient. So that is a live kind of an input that you can get with this particular AI agent browser. So these are basically AI agents that is now coming up. Even GPT-5 has these agents that you can use. So this is something to see. Possibly this is going to make the workflow of a clinician a little easy if they're trying to use it. But we are all going to explore using it in our own way. So this is a very interesting space.
That's very exciting. But would you require the EMR to approve it first? Like the EMR should give the permission, or it will?
So this is the fun part of this Comet browser by Perplexity, is that it reads the entire web page. So if your EMR is a web page, and you open up your EMR, it will automatically read the entire content and summarize it on a side browser. So myself were discussing this in one of our workshop and in one of our discussion. And it's amazing. And I think more and more agents are going to come up. But the caveat is there is no guardrail set for this. The data privacy is in question. Regulation is not set. But all said and done, this is a very good workflow that we can expect as a doctor. Because sometimes, when you're sitting on an EMR with 15,000, 20,000 patients, I've been using it for 10 years now. And, sometimes you need to go back to that patient's 2023 record. You just have to just browse it back. So that can be summarized. That work can be summarized. It can help you miss out. Sometimes we look back, when was the last time I screened the patient for neuropathy? Right. You need to look back. Was it done in a year's time? Was it done beyond a year's time? So all that things can be done in that 10 minutes of time that you have with the patient. So maybe something we can all explore doing it as we go along. But fantastic presentation by you. And I'm sure for those of our friends who are still living under a rock and have not used ChatGPT, this should be an eye-opener that you should get yourself started with using GPT, at least for your day-to-day creative work, if not for your clinical.
There are many people like this. What happens is that people like you, who are always surrounded by people who are using AI, would not know that these are actually a handful of people. So when I go in a CME in Jaipur, if I ask people to raise their hands who are using ChatGPT itself, 10% would be using it. Rest 90%. Yes, I tried it once, installed it and uninstalled it. I didn't find it useful because they still don't know that how many applications are there for their own clinical practice.
Absolutely. So this helps. I think this guidance helps. And I think, together as a medical community, from all aspects, from the Doctors AI community, from our regional the specialty-based communities, like you are representing the RSSDI, the Research Society for the Study of Diabetes in India. I'm sure Dr. Gurunath is associated with the Cardiology Society of India and the other organizations which are working. I think each of us holds the responsibility of taking this literacy, to our colleagues in our own specialty, and help them understand the leverage that AI tools can give you in your day-to-day practice. So great session today, Aishwarya. I think we had two very good presentations, one by Dr. Gurunath, and I think that's very promising. We'll open up a lot more discussions on using AI in ECG and picking up patterns. And I'm sure Dr. Rakesh will join us in November as well, and we'll get some more hands-on training from him on how to use ChatGPT for basic purpose. So Grace, thank you so much.
Yes. A great segue, sir, to tell our audience about what's going to happen at Doctors AI Global Summit, when it's going to happen. If you could just share a few words on it.
So I guess everybody knows that we are doing the Doctors AI Global Summit in November. We'll be looking forward to hear from not only our experts from the country, but we'll be having about 8 to 10 international speakers will be joining us in the summit. And one very important takeaway is the ICAIM workshop. And this workshop is going to be like a hands-on workshop, which some of our experts in the community is going to take you through. So we're going to have a 3-hour workshop with a certification coming up at the end of it. That's going to be on Saturday. And beside this, we have some fantastic specialty-based session. Dr. Rakesh is representing also Diabetes India, and we will have a expert session from Diabetes India on AI in diabetes care. We'll have a session with the Public Health Association of India, with the Indian Society of Critical Care Medicine, Medicine, with the Indian Pharmacological Society, and so on and so forth. We'll be having specialty-based track in the summit coming forward. We'll also have, a session where we will be inviting some startups to pitch their solutions and take expert feedback from the medical community. So a lot is going to happen in those 2 days. So we'll invite all our community members to register for the Doctors AI Global Summit if you have not yet registered. If you have an AI research work, if you're doing avid research like Dr. Gurunath sir, you can submit your research, and I think the submission is still open. You can still submit it by tomorrow, and you can present that in the summit as well. For those of you who have not yet registered, there is a special registration rate going on in this Independence Day week, and this is the eve of the Independence Day today. So we'll invite all of you to register at this special rate within this particular week. So thank you so much once again, Dr. Rakesh, Dr. Gurunath, for joining us and taking us one step ahead in AI literacy for the medical community. We appreciate everybody's effort. Thank you so much, MedSynapse team, for hosting us. And thank you, Aishwarya, for moderating this. And I invite once again each one of our colleagues for joining us at the Doctors AI Global Summit 2025 on 15th and 16th of November in Bangalore. So on this keynote, thank you so much, and we will all see you next week in the Doctors AI Update Hours. Thank you very much for joining.
Thank you so much. Happy Independence Day.
Thank you.
Happy Independence Day to everyone.
Thank you.
Thank you.